Hello everybody and welcome back to my channel, and coming again with another episode of my CRNA journey. I will be talking about a recap of my third semester. So if you are new to my channel, please subscribe, like and share, and if you have been a subscriber, don't forget to like and share anyway. So today I'm going to talk about a recap of my third semester into CRNA school. I'm going to share with you the courses, the material that we covered during that semester, and the things that I felt were very hard versus things that I took it for granted. And we're gonna learn the lesson. So if you are a nurse or somebody just interested into going to CRNA school or just want to listen, be comfortable and let's dive into it. So talking about the material that I covered during the third semester, we went through surgical procedure 1, because on the fourth semester you get the surgical procedure 2. So we went through surgical procedure 1, we went through coexisting disease 1, advanced patho lifespan, and finally regional. So all these 4 materials were heavy. So it was a busy semester, very heavy and very important, because the stuff that we were covering were actually like the disease itself. It wasn't like back in the first semester when we covered to the molecular level, all these physiology things in the body, but this was like the beginning of the big game, if I can say so. So starting with advanced lifespan, during the third semester, things that we cover were mainly cardiac and pulmonology. So we went into the rhythms, we went into analyzing all the rhythms that you could possibly have on a 12-lead EKG. We went into cardiac pathologies, like specific ones. We went through understanding, again, not just the pathology, but the physiology. So it was like the information we're building from the patho and the physiology that we had during the first and the second semesters. So, and it was really cardiac heavy more than pulmonology. But again, when we started talking about lung, we went again through the lung sounds. So that reminded me like health assessment that we did on the second semester. And we went into like a little bit of the anatomy of the lungs. We talked about some specific disease like restrictive versus obstructive disease, and what could happen like when you are at the bedside, your patient desaturate and maybe hypoxic. We went all to all those mechanisms. So it was very heavy and challenging, but the things that I felt that helped me, it was having a strong base on the pathophysiology of all the system. Because remember, in this school, you keep adding on more on the information that you already received. So once you get that base and you keep working on getting the information on top of that, I feel like it puts you in a better position for the things coming ahead. So yeah, it was kind of very hard. So I would say I was studying that material. I spent like 3 hours a week or 4 in total to study just for that specific topic. And we also had like few workbooks along that we needed to complete through Apex. So yeah, it was kind of busy. So that's for advanced lifespan. So next material we covered was regional. Regional. So it was all new. It wasn't something that we talked about during nursing school, or even when I was a bedside ICU nurse. So, and I was really excited because I always heard CRNAs or maybe anesthesiologists talking about regional. So I was very excited. And the first thing that I learned is that regional is all about your anatomy. You need to know where each muscle is, what is the innervation, and the what vascularized that muscle. You need to know and have it in mind. And on top of that, you need to be able to use the ultrasound. Yes, you have to learn that. But like I said, it sounds heavy, it sounds intimidating, but it's not once you learn the proper way and you are willing to go back and review your anatomy. So for me here, my biggest experience was to use the ultrasound. It was my very first time using that. I just to learn how to use it and to learn the different plane and which frequency is better for this area versus the other area. These are the things that I had to take time to understand. And at the same time, like you all know, I'm going through a hybrid program. So I was on campus only 3 times that semester that I could use the ultrasound. I did not buy a personal ultrasound because when I talked to the upperclassmen, they advised me not to, and because of the fact that when we start clinicals, we will have ultrasound at the hospital. So I did not purchase my own ultrasound, and I was only relying during intensive to get on campus to use the one that we have available for students. So only having to touch that machine 3 times wasn't going to give me everything I needed, but at least I received the basic education to safely look at something, look at the things that I need to look at on ultrasound while doing a block. So you're going to learn at looking at vessels, muscles, nerves. They all have different kind of opacity and all that. So yeah, I was very excited when I was very excited. So again, like I said before, you have to touch base again on your anatomy, right? And know which blocks are better for which kind of surgery. And on top of that, you also have to learn your medications, right? You have to learn the dosage. Like during that block, you're going to talk about C-section. We talked about the different dosage, the volume, epidural versus spinals, the indication, the contraindications. So it was very fruitful and it was a happy experience. Like the entire semester was heavy, like I said before, but this very part was all the way new, but very excited. So the way I was studying for that is every single time that we'll have, let's say they were talking about femoral block, now I'll go back in my anatomy and visit the entire thigh region and see all my innervation, the muscle, vasculature, before I even get to study for the block. So that class took me a lot of time studying. I basically studied for it like every single day. And I remember during the final, because the final was comprehensive, I remember not sleeping the night before the final because I was going through all the PowerPoints and making sure I have my anatomy packed down, because it is something that even though you don't go over the anatomy again during the class, when they do those exams, they expect you to know the anatomy and they will ask you questions about it. So I stayed up all that night. I went to bed like 2 a.m. trying to have everything packed down, and it pays a lot, and I'm glad I did that. I'm glad I was able to have the knowledge I was required to have in order to be proficient in that course. So yeah, I will say, if you are in CRNA school and about to get to jump into your third semester, things you can go ahead and do to be just ahead of the game is to review your anatomy for a regional. So next we had surgical procedure 1. All the new stuff were happening during this third semester. So with surgical procedure 1, the main thing were the disease, the surgery, and the OR game. So OR means operative room. So that was the big game. So you have to know, like, let's say if they are talking about prostatic resection, like prostate resection, and you need to know about what is the prostate, what are the indications, what kind of disease could lead to a resection of someone's prostate. And again, you need to know, as a CRNA in OR, what are my duties, what am I expected to do. You also need to know, on top of that, what are the complications that could arise and how will I manage them if they arise. And on top of that, you need to know, for this procedure, do I need a regional block or can I go with general anesthesia? All the things were coming together. Like I said, the third semester was the boom. All of it all mixed. So it took me a long time to reshape my brain, moving on from nursing background, where at the bedside, basically we were applying the orders, even though we still have that critical thinking, but this was shifting from that to be the person placing those orders and applying those orders on a patient in a real-time base. So this is where I realized that this is something you want to learn. This is something you want to know what you are doing, right? You want to take time, not just learning to have good grades and like A's. Yeah, I'm having A's, but you want to learn for yourself. You want to be a safe provider and keep that license active. So this is where things were really changing for me. I had to shift from that mindset and think more in depth like a provider, not just as somebody that has critical thinking and can read through the order and apply them, but also somebody that is a provider that can place the orders and apply them and maintain even a higher level of critical thinking. So surgical procedure 1 gives you that, what you need. Like, you need to understand the disease process, you need to understand the indication, you need to understand your role, you need to understand, what am I giving these medication versus these according to these criteria that my patient have. And you need also to be ready for any complication and to be quick to address them. So this is where I started shifting, understanding all this and digging into my study, knowing that this is for me, this is my life-changing game, this is my career, this is what I'm going to be doing every day. I need to learn, I need to understand, I need to be able to be proficient. So yes, surgical procedure was the best. It's one of the best class I had, and I am very thankful, because not that I am yet there, but I feel like my brain is now towards CRNAs versus ICU nurse. And last but not the least was coexisting 1. And coexisting 1, still a little bit soft, but not that soft. What we did here was talking about the disease, and it was a little bit of repetition from what we had during the first and the second trimester and the second semester. It was just like a general review of diseases. Like you're going to talk about things like rheumatoid arthritis and all the disease. And what my school did, or at least my instructor, was to place them hand by hand, my surgical procedure one and my coexisting one. So if we will have gone through a disease process in coexisting, and the next day we will have talked about the surgical implication of that same disease. So it was like the information was cohesive, everything was coming together, and it was kind of easier to solidify that. So you will review the disease, and then you review the surgical implications of that very disease that you just reviewed. So I feel like this is something that I will give a kudos to my school and my instructors for doing that. And also I had an amazing instructor teaching the same, one instructor teaching the surgical procedure one and the coexisting one. And what she will do, she will walk us through cases, and she will present the case as if it was in the OR. And also she will bring her personal experience to the table and let us talk through things that were supposed to be done, things that were well done, things that we could go in another path. So it was an amazing experience. I felt like I grew a lot in my CRNA's curriculum just with this surgical procedure one and coexisting one. It was like a different game from nursing school that we all went to. It was more now focused on you, CRNA, your career and things like that. So these are the four classes I had to cover. Heavy but worth it. So if an advice I could give to someone going in third semester CRNA school is review your anatomy just to be ahead of the game for regional. And I would say learn as much as you can, because not just because this is for your own career, it's for you to be a safe provider, to keep that license active. Assume your role every time that you study, and this is something that I felt like helped me so much. Like when I was reading through my surgical procedure and I was picturing myself at the OR with a patient having to go through that procedure, and what I will do, what I will not do, complications that can arise during the surgery, and how will I handle them. So viewing this like that really helped me grow as a CRNA student, shift my mindset from the bedside critical nurse to be a provider. So yes, learn your anatomy, study like your life depends on it, and do your best. Yeah, it's heavy, but the good thing about that is time flies once you get into that semester, and then you just realize that, oh, it's gone. So get as much as you can while you're staying in that semester, because it's a deal breaker. So this is what I have for this episode. Thank you so much for being a subscriber, or if you liked and shared, thank you, and see you on my next episode.